Linda's on?
Yes, ma'am. Hi, how are y'all?
Yes, hi.
How's things going over there at Vital Care?
We have a good flow going. Finally, this is our new normal and we're not overwhelmed.
Good.
Yes, ma'am. How are y'all managing?
We're doing good. Working from home is allowing me to catch up on stuff. And I'm still a lot of client-facing things that we can take care of during this time, answering questions and providing some resources and support. So this has actually been kind of an interesting time for us as well.
Oh, I'm sure. I am sure.
And it looks like we also have Lisa Amory. Is that who I'm?
Hey, Lisa. Lisa's from Charlottesville Medical Research.
Okay, and we also, I think, have Laura Babick. Is that?
She is from Vascular Surgery Associates.
Okay.
Hey, Laura. Hey, Lisa.
And I think we're also still waiting for Dr. Maynor. Is that how you pronounce that?
Dr. Maynor, yep. He's from the Nags Head area. So Laura's in Richmond. Laura is in Richmond. Lisa is in Charlottesville. Amber, you're the Midlothian area.
Yes, ma'am.
And Dr. Maynor is Nags Head, North Carolina.
Okay, so it's looking like Lisa does not have a mic. So Lisa, I'm really good at speaking for other people. That's kind of my gig. So you just,
yes. And
we can all, I'm assuming that what I can see here on the bottom of my screen, the rest of you good people can, when you see your messages. So that's what we can do. We want to wait a few more minutes to see if we can get Dr. Maynor on here and then we can sort of start. But and it seems like Angela, you know everybody, which is not shocking.
And you know what? This social distancing, this is totally my thing. I know all these people.
Yeah, you're like a cat. You want everyone to know you, but also stay away.
Yeah, stay away. But I do have to say that these are some of my favorite clients. Very much so. And I don't even have to lie about that this morning.
Well, thank you.
Good.
I don't even have to lie about that this morning.
That's good. That's good. Yeah. Well, just to let the people who are on here know, my name is Elizabeth Johnson Phillips. I'm sort of the one who's been sending the emails. I am the content developer for MPWRSource. That's a fancy way of saying I work with words. So today I'm going to be the moderator and just sort of asking questions. I'm going to give space for for Angela, Tommie, and Tiffany to sort of say what their expertise is. I'm going to go ahead and apologize right now for my dog. If you hear jingling, that's what you're hearing. She's very excited because I'm talking to. She hears other voices and she thinks there's other people here in my house, which means she thinks someone's here to see her, and that's not the case. So she's confused. Angela, if you wanted to start to sort of say, I mean, clearly these people know who you are, but sort of say what you bring to the table in terms of, in general, helping companies protect their reputation and make sure that they are following all the rules and regulations, but also how that applies to our current climate in regards to coronavirus.
So I think that what we're seeing in this environment, from a compliance standpoint, is that it highlights what we already knew. We already knew about infection control and what those premises were, and they haven't changed. The new OSHA guidance that has been put out is based off of the traditional infection control, infection prevention standards that we have used for the last 50 or 60 years. We're not going to see any major changes to OSHA. Those rules have been in place and have worked. The bloodborne pathogen standard has worked for years, so we're not going to see any changes there. We saw a relaxation of the HIPAA rules, and we're seeing some areas of the rule that have always been there but have not been used as much because we have not faced this kind of a disaster since we first wrote the rules. So when we think about, why do we need some of the areas of the rule? Why are they in place? it really surrounds, if you think back to Hurricane Katrina, right? So most offices are thinking about those types of disasters, and we never really considered a pandemic. When we had swine flu in 2009, we did not have this kind of public reaction to it, nor did we have a government reaction to it. So our last major pandemic really is 1918, right? And that's a whole different time period, a whole different thought process on what we do and how we can, from a medical standpoint and then from a compliance standpoint, deal with those types of things. So today, you know, I think through the question and answer, I'll be able to answer some questions about the new guidance that's out from OSHA and what that really means to us, what we need to continue to do and what we should do moving forward. I think the new normal is what should have been in place to begin with. And then I'll be able to talk about the areas in the HIPAA rules that seem gray or uncertain to people that are on the line. And I think Dr. Mainer's on the line now.
Oh, good. Good. Yes. Hi, Dr. Mainer. So we just let Angela talk. I'm going to let Tommie go next and sort of introduce herself and let us know how HR can save us all, you know.
Great. Well, good morning, everyone. I'm Tommie Deaner, and I'm a HR professional. I've been in the HR industry for 25 plus years. I've worked with large Fortune 500 companies. I've worked with small businesses, mid-sized businesses, and I've been in a lot of different industries, from financial services to energy to medical practices. So a wide range of experience in my background. I currently am reeling from all of the changes related to COVID-19, to be honest with you. Unlike Angela, what we're starting to see on the HR front is a tremendous amount of changes in response to what we're seeing happening. If you think about the Paid Family Leave Act changes, there's lots of changes that got enacted through the CARES Act related to 401k and hardship distributions. People are having to deal with this new normal in terms of furloughing employees, laying off employees. You know, so there's a lot of action and activity on the HR front, and it's been a little bit challenging to keep up with all of the changes, as well as the announcements are coming out, but the federal and state agencies aren't ready to enact a lot of those announcements, and some of your vendors aren't ready to enact those changes. And so, you know, trying to balance the communication related to the changes and for your employees as well. So it's challenging. And so, you know, it's hard to say what that new normal is going to look like. A lot of these things that are being enacted really are about keeping people employed, but I don't know how sustainable that is with running a business. So, you know, there's a balancing point, I think, that a lot of people are struggling with in terms of, you know, seeing reduction in their services, of people coming into their practices and offices. And so that's a real challenge, I think, for business owners right now, is how do I take advantage of some of the relief packages while still being able to financially maintain my company? And so it's a true balancing act.
And last but not least, we have Tiffany Joy Greene of MPWRSource. You want to give us a rundown of all that you bring to the table?
Sure. So first of all, let me apologize. I'm a bit hoarse. This is also pollen season, and it's one of the worst we've ever experienced. And I suffer from asthma and allergies, and I have been known to go into anaphylaxis due to pollen. So don't worry, I got all my meds surrounding me, but just in case, just so you know. So for many of you, most of you probably don't know who I am. I'm the Chief Growth Officer of MPWRSource, and excuse me. Our focus is helping small businesses, and we do that in 3 ways. We help them grow, we gain them peace of mind, and we help small businesses operate efficiently. And we do that through our own resources, which is our inbound marketing, communications, public relations, and sales experience and expertise, but we also have our superhero sidekicks. So we have our superhero sidekicks. We're all kind of banded together. We have others, but we have some here, which is Angela and Tommie. And those superhero sidekicks bring the IT components, the compliance and reputation components, the HR, the business planning, and advisory services. So we really take on a holistic approach to your small business. So that way, well, we believe that no facet of your business should operate in a silo. They should all operate together. And if you have been to our website, you know that we are superhero fans. So when I say that, operations of a business should operate like a spider web, like Spider-Man's spider web, all together and interconnected. So today we're talking about crisis management. And MPWRSource's superhero powers, as I said, is communications. So how do you operate in a crisis with crisis communications? What is your plan? Do you have a plan? I believe that a lot of small businesses probably don't have a plan. Did they have a team in place to be able to react to such an event like this, or any event? Because as Angela mentioned, you have hurricanes, you have other crises that happen, and are you prepared for that? So I think through this crisis, we're learning that possibly for future crises, because we know more will occur, hopefully different ones, but more, what kind of plans, smaller ones, what can we do to be better prepared? So there are three things I just wanted to highlight in terms of communications and specific communications within a crisis, and there's three. Make sure that when you're communicating to your internal staff and either your customers or patients, clients, that you don't try to portray to know everything. Don't feel like you have to be the expert in everything, because guess what? None of us are, and people know that you can't possibly be. So what does that do? That builds distrust. The best thing you can do is communicate clearly, frequently, and most importantly, authentically. Transparency and honesty are always key. And in a crisis, everybody looks for a leader who can do those three things. The second thing is during a crisis is to communicate your purpose and communicate that clearly. So everybody knows, what are we doing through this? And in essence, in communications and in leadership, when there is a crisis, no matter how big or small, everybody wants to gain a little bit of control. They want to feel like they have control over something. And that is why we have no more toilet paper in the grocery stores. That is their form of control. That's all that is. So as a leader, we need to give them their control. What is that? What is your purpose? What is your purpose through this crisis? That will ease their mind. Of course, there's going to be stress. Of course, there's going to be depression. But through it all, that sense of control, even if it's a little bit, will ease that stress a bit. Third, taking the opportunity to build tomorrow's leaders today. Through a crisis, you see how people react. You can see through your team who really rises to the occasion. Take advantage of that moment. This is your time to really see who your true leaders are. So those are my 3 bits of advice through crisis communications. I feel like if you have any questions, feel free to reach out.
All right. Thank you, ladies. So I'm just going to start off. A lot of these questions will be directed towards one of you specifically, but then I'm going to give the other 2 of you a chance to speak to that and how it relates to your expertise. Definitely some of them across the board relate to everybody. For example, well, I can even just start with this one. One of the questions that I've gotten is, what do I say to my other employees if one employee is diagnosed with COVID-19? There are aspects to HR, to compliance, but also to communicating. It touches all the bases. So we're going to start with Tommie with that one. What should a business do if an employee is being diagnosed with coronavirus?
So a lot of this actually plays in with probably what Angela would say, is that you really have to do your risk assessment related to that exposure situation. Who has the employee come in contact with? how long were they in contact with that those other employees? Were they wearing any PPE? So, there's a lot of different things. So I actually would say it would start with the risk assessment on the OSHA side, and then you can figure out what you need to do on the HR side. So I'll turn it over to Angela and let her kind of talk through that, and then sort of what the response would be on the HR side.
So this is really, if you have an employee who is diagnosed with COVID-19, this is really driven by the health department. So anytime, so first of all, for infectious disease, we have reporting requirements to public health. And this happens to be one of those because of the way, the easy transmission of this and how fast it can spread. So the first thing is that the health department becomes involved. You start with the presumptive positive that the patient or the employee has COVID-19. Once they diagnose, if they diagnose the COVID-19, then what they'll do is they will look at, first of all, what type of practice is it? Who came into contact? So who were all of your patients in the last 2 weeks? Because we know we've got that 2 to 14 day incubation period. So they're going to look at all of the patients in that time frame. And it depends on the jurisdiction you're in. I had this happen in North Carolina, and they notified all of the patients that they had been exposed, and they ordered them to self-quarantine. But then the same thing happened here, and it wasn't quite the same. They actually responded to all of the employees that would have potentially been exposed. So the jurisdiction will play in this, but this is largely driven by the health department. You have to make sure that you report. So I would imagine anytime you have that, you're going to have whoever diagnoses the patient, the employee with COVID-19 is who has the reporting responsibility. Then the practice or the client, the company, will then be contacted by the health department, and they'll get the relevant information from them. And that's mandated. We have to provide that info.
I think from an employee notification perspective, I mean, obviously, and many of you probably have small practices, so your employees will know who the individual is, but HIPAA still applies, right? So you can't say that John or Joan was exposed, but you can just let them know that an employee was exposed. Obviously, any actions that you need to take to then quarantine your employees if they've been in a process. So, there's a lot of different components to it. And again, it really does depend on the situation with the employee, how long the exposure was, those different types of things.
So I'm gonna push back a little bit of this to you, Tommie, because HIPAA only applies to the patients of the covered entity.
Okay.
So it's not for the employee. So really, from an HR perspective,
yeah, it's the confidentiality.
I don't know what those rules would be from an HR perspective, but as far as the HIPAA perspective goes, that is
Sure.
just between the covered entity and their patients. Now, if we're talking about an infectious disease practice or a family practice where they're a testing site right now, and one of their employees tests positive, and they are a patient of the practice, then absolutely HIPAA applies. But this is really your world when we talk about the employee of what are the HR rules.
Correct. Sorry,
no, that's okay. I think that there's.
I said the wrong thing, but thank you.
I don't know what the HR rules are that apply to it.
Yeah, it's confidentiality. It's the confidentiality. So my apologies for using the wrong reference.
I'm sure you're going to challenge me in just a little bit, so it'll be all right.
That's fine.
Let's watch.
Where's my popcorn?
I don't know how well she spars yet, so I don't know about that.
Well, it'll be fun to find out. Tiffany, in terms of, in light of the confidentiality that Tommie just spoke to, and the HIPAA being between the patient and the doctor and the confidentiality, how in terms of communications does that affect, for the lack of a better say, let's say we have an employee in a medical practice. I'm assuming, and Tommie, definitely correct me if I'm wrong, that there is some obligation to alert patients who have been exposed to this employee. But obviously those communications, it has to be a delicate balance of balancing confidentiality, but also moral obligation to let people know they've been exposed.
Yeah.
What does that dance look like, Tiffany?
I mean, I think it's pretty easy. I think you contact the patient to let them know that when they were in your office or your location, that they came in contact with an individual who had tested positive with COVID-19, and that your recommendation is that, you know, they self-quarantine, or if they're exhibiting symptoms of COVID-19, that they should try to get tested at a testing site. You don't have to disclose who the individual was, and that's really the component of the confidentiality that you'll want to maintain, is that you know, you don't release the name of the employee, but you absolutely let them know that it happened.
Well, can I will give you a real life example of what not to do. How does that sound in terms of communication? So there is an employer out there who has had a coronavirus employee, and they decided the best practice would be to do a FaceTime conversation with the coronavirus victim and everybody within that company. And that person was put on the spot and said, or basically the point of it was, see, she's not dying. This is great. She's not dying. So, and what they did was they let this individual talk, and then everybody in the company panicked. So, because what was their concern? Well, what now? When did she actually get this? Do we all have it now? What's going to happen? So it created fear amongst the organization. And in response to that, the higher executives decided to quarantine themselves at home, and everybody else was business as usual. So what also happened was there was a lot of profanity that was started to be occurring, and saying, I'm not going to repeat the profanity, but basically this person better not come back to this place ever. She's going to kill us all, and how dare she probably already did. So the point of me sharing, so this is a real life example of what really not to do. So what could they have done differently? Did they show compassion? There was no compassion given to anybody. It showed that there was an attempt to be authentic in their response, right? Like, look, here's the employee who has it, right? I'm trying to show you what's going on here, but all that really did was put that employee in the limelight and made that employee feel comfortable. Then certainly, what are other employees' responses going to be? So in essence, there was no real, it actually facilitated the fear, and it did not keep the ball, as I say, in the court, right? They didn't take the ball and like try to make people feel safe and secure, and really let people know that they actually care about every single employee within that company, and that they're going to do everything in the power to keep every single person safe.
Tommie, would there be some HR ramifications to something like that?
I'm sure there would be.
That's the time Tiffany was talking.
Sort of what we're talking about related to confidentiality. While employees can probably figure it out, you don't have to put them on a pedestal and show them off. You know, I think that's kind of counterintuitive to, you know, making sure that we treat employees with respect and you know, handle the situation appropriately. I think from a leadership perspective too, you know, the leaders ducking out of that situation and then sending the employees in is an example of, you know, just not a strong leadership decision, unless there were other factors that played into that. So, for example, maybe they were exposed for longer periods. more than the 6 feet, longer than 15 minutes, those types of things. So I don't know the whole situation there, but obviously, that's a good example, Tiffany, of what not to do. I think kind of getting back to Tiffany's original point about transparency, not knowing everything, it's important to let people know what you know when you know it, and to be genuine when you do that, and make sure that you're being rational and calm in those communications, and not kind of overcorrecting, so to speak. So.
Okay, so we've talked a little bit about what to do with if an employee's been diagnosed with coronavirus. Can employers, one question we've gotten is, can employers require employees suspected of exposure to or contracting coronavirus to be tested as a condition of returning to work?
So Tommie, from a compliance perspective, we write infection control plans. And the infection control plan would state if you had an employee who had a contagious or infectious disease, which would be our recommendation, that they do get clearance from their doctor before they come back to work. So that is from our compliance perspective, as far as the OSHA infection control, providing a safe and healthy workplace. So Tommie, I don't know what the HR implications are behind that, but when we write infection control plans, we try to make sure that we have those contingencies. And one of the things that, absolutely CentraVance is rethinking right now is making sure that we rewrite our infection control plan to be a little bit more specific about respiratory illnesses. And this is something that we do allow our clients to review. They have the final say in what their infection control plan looks like, but our recommendation would always be infectious disease, anything contagious, that their doctor clear them before they come back.
Yeah, I think that's a good best practice as well, especially if they're known to test positive for COVID-19. The challenge, I think, right now in our landscape is the testing resources are somewhat limited. So people who are suspected of having COVID-19 may or may not be able to get tested if they're not displaying the symptoms, like the respiratory symptoms. They have to meet certain things before the testing facilities. So if that's the case, I think you need to make sure that you're monitoring employees before they come back into the workplace to make sure that they're asymptomatic for a period of time, and that they're not displaying any of the symptoms of the disease, of the infection. So, I think it's going to depend, but absolutely, if someone's tested positive for COVID-19, you should wait until they get a negative test result before allowing them to reintroduce into the workplace. But if someone's suspected and they're unable to get tested, I think you're going to have to, follow some of the CDC guidelines in terms of, when it's going to be appropriate for them to come back in.
I have a question. I know an employer who is forcing, where they're saying that somebody who has COVID has to be tested twice, and it has to come back negative before they can come back to work. Is that okay for them to do that then?
Yeah, I think it's, the landscape's really evolving. And Angela, I don't know what your thoughts are, but, what they're starting to see right now coming out of China is that people have tested negative and then a period of time later have come back positive. And so that's where that 2-test result change is coming in, Tiffany. That's relatively new. I think that's probably been within the last week or two that we're starting to see those recommendations. So I think you have to really consider for your business, the risk level related to that. And so you may want to consider, even after a negative test result, even if you don't get a second test, maybe there's a period of time that you have them wait after that negative test result before coming into work. So again, working with your compliance folks like Angela to kind of figure out, do the risk assessment on the actual exposure case, how much risk it would be to reintroduce that person into your workplace.
Okay.
One of the things that I always tell my clients is, I am the compliance expert, and I will help develop your policies, but it's always a good idea from a risk perspective And right now, nobody's going to have a written policy that says you either have to be tested for COVID-19 before you come back to work, or you have to be tested twice. So there's going to be no written policy. So the legal ramifications probably extend beyond what Angela would be able to offer, or even Tommie would be able to offer. And the unfortunate thing is that we live in a very litigious society. And so when we start trying to mandate that employees do something that we don't have a policy standing behind, I think that opens us up for great risk. So, so that goes back to definitely one of the things that we have evaluated is rewriting and strengthening our infection control policy for the practice, because that includes sick employees or employees who become sick. What do we do with those employees? And back to the whole thing of don't work sick. That's always been the mantra. Unfortunately, we don't follow that very well in the society. And sometimes it's because I need to work. Sometimes it's because I'm afraid to tell my employer I'm sick, and because I might lose my job, or we're shorthanded. But we absolutely have to get back, especially in the healthcare world. You don't work sick.
Yeah, and I think that's really important, especially now. It's really highlighting some of the gaps from a employment and people policy perspective. So I love the idea that some of the companies out there have come out with providing employees pretty early on with additional sick time, because they recognize that this was a pandemic, and they wanted to encourage people to stay home if they were feeling sick instead of coming in. And so sometimes your PTO policies and your vacation policies discourage people from staying at home because they are sick. And so, while you may not have a formal policy, being able to pivot and be agile during a crisis like this is super important, and being able to maybe make some modifications and either tightening or loosening of the reins to address the situation. And so, again, it's about making an appropriate business decision and weighing out the risks. This process has been super dynamic, and my responses from the beginning of March to today are very different. And I think, again, it gets back to a lot of what Tiffany is saying, is just regular communications to your employees. So one of the clients that I work with, we've been sending out, at one point, it was almost daily changes and updates to the company's position, even as we were watching screening guidelines and CDC changes and recommendations. But even from a personnel and employment perspective, we were modifying our position on things daily as we knew more about it. And we told employees at the beginning, we don't know what this is going to look like, and we don't know how this might change, but this is our position today. And we might follow up in a day or two, and it might be different. And so I think it's important for you as leaders and owners of businesses is to make sure that you're constantly communicating with your employees that, this is our position now, but we don't know everything about this. We're learning more about this pandemic. And as we learn more, some of this may change. And I think that's fair. And employees, quite honestly, we're pretty resilient as human beings. So I think that people appreciate that position. So. Angela's laughing at me, and EJ is.
I'm not. I am laughing at Elizabeth.
Thank you. I am.
Because I was just messing with her.
I live to serve with the pleasure.
Tommie, you are one of the smartest women that I know, and so no, I would never laugh at you, and I still don't know if I can spar with you. So
I was wondering if I made a weird face. I'm still getting used to these Zoom team meeting chats.
It is. You get out there and you're like, oh gosh, that's what I look like. This is.
And I talk with my hands, so it's really hard on these meetings because I recognize it's really distracting. So.
Well, I discovered that it's physically, I can't not touch my face. It's like my favorite thing to do. I've tried. So given what you guys have just spoken about, we've talked a little bit about if an employee is diagnosed, who we have to communicate with. How does this relate to, and you've really honed on don't work if you're sick, really no matter what industry you're in, but particularly if you're in the healthcare industry, don't work if you're sick. Well, how does this affect with the different legislations that have been passed in terms of, I guess the question that I have up here on my screen in front of me is, how does COVID-19 leave work? Like, what does that mean? I know that there's been different laws passed. What does that look like?
So
Are
you asking how, so my take on that question, I would think I would go to an infection control point of view. So is that the question? How does it get from I'm in the healthcare facility to out into the community? Is that, what is the question?
No, I'm kind of thinking in terms of like an HR perspective, in terms of what am I, an employer, required in terms of
Didn't the federal government,
those types of things. What am I required by law to give to my employees if they're sick?
Yeah, didn't the government enact the COVID Leave Act?
The Leave Act. Okay, yeah, so that's totally different. Yes, now I'm with you.
So my answer to that is it depends, and it's complicated.
So clear. Thank you for clarifying that.
For large employers, people over 500 employees, it really didn't do a whole lot. It didn't affect them because the FFCRA, or whatever the acronym is for the family leave, was not enacted for large employers greater than 500. So for smaller employers, it also depends on what provisions under the Small Business Administration, those loan programs and relief programs that you have to use. So, it depends, and it's complicated. So, I think it's going to depend on your individual situation, how many employees you have, but definitely you should be looking at that Leave Act provision.
Okay, that makes sense.
Sorry, that's kind of a non-answer to your answer, but it's very complicated and involved. So,
Tommie for office. Sounds like a political.
Yeah, that was a political. No, so okay. The next question I have is definitely an HR related question, and that is sort of to explain what's the difference between a furlough and a layoff.
Yeah.
And how does that affect my business?
Yeah, so a furlough and a layoff, they are different. It's subtle, but they are different. A layoff is when you actually lay someone off and you terminate their employment with the company. A furlough, it could be one of two things. It can be a furlough reduction in hours, or it can be a furlough where they don't work for an indefinite period of time without pay. But people who are furloughed generally have an expectation that they're going to be returned to work at some point in time, and generally their benefits are continued. Okay, so that's the primary difference between a furlough and a layoff. I would say that my preference would be to do furloughs, especially because we're hopeful that this is a temporary situation and that businesses are going to come back after all of this is done. And so doing furloughs allows you to ramp your workforce back up the same way you ramped it down. In both situations, employees are eligible for unemployment compensation in the state of Virginia. So they'll still be able to apply for unemployment and if they're qualified, receive the payment from the VEC. The VEC still has not posted any guidance on how they're going to apply that additional $600 under the CARES Act. That's a question that I'm getting a lot, almost daily. And I just went to the VEC website around 8:30 this morning, and they hadn't published any additional guidance. So we don't know how that's going to apply yet. But in the state of Virginia, employees can get a weekly benefit anywhere between $60 and $378, depending on their earnings. And then how that CARES Act, that $600 will play in, we don't know yet. But that's the primary difference between a furlough and a layoff.
Okay, that makes sense to me. One question I had, it's up here, it says, is it wrong to, and this kind of speaks to being furloughed, is it wrong to promise people that they will get their jobs back when this is all over? What do I say?
Honestly, I would not advise my clients to promise things that we're not sure will happen. And I know that's tough. But you know, we still don't believe that we've hit the peak of this pandemic here in the state of Virginia. And this could go on for a while. And so what I've advised my clients to say is to say, you know, it's my intention to bring you back. That is absolutely the plan. I can't see into the future, but that is absolutely what we're planning. And especially if you're doing furloughs, you can say that's why we're doing these furloughs, so we can make it past this, because furloughs are being done for a financial reason, right? You know, financially, you would enact these furloughs because you're trying to get to the other side to make sure that your business remains viable. And so you're trying to reduce some of your payroll expense so that you can continue to operate your business. Otherwise, you could just let them use PTO, right? Or their vacation time. So, you know, again, I would caution against making promises, but clarifying that it's your intention, this is what you're planning on doing, and being transparent with your employees.
It kind of goes back to the communications of what I said too, which is number one, being authentic and don't come across as you know everything. So if you don't know what the outcome of this is going to be for your business, you certainly shouldn't make a promise that you don't know you can keep.
So sort of the old adage to under-promise and over-deliver.
Correct. And I did read this morning that they're predicting the peak in Virginia to be April 22nd.
Today, that's the prediction. I mean, you know.
They did a really good study. It's obviously not exact. Like, we don't know if it's going to, but for Virginia, it looks like it's going to be happening closer to the end of the month.
Okay. So some of these questions I've gotten sort of, you've ticked off on already. One question I do have, I know a lot, this is going to be probably more for Angela. A lot of medical practices are ramping up their telehealth usage, and how do we know that a telehealth platform is HIPAA compliant? What does that look like? What does a healthcare provider need to do to make sure they're checking off all the boxes in providing telehealth for their patients?
So the first thing is, and I'm just as guilty of using that word HIPAA compliant as the next person is. But what I generally tell my clients is that anybody that tells you they're HIPAA compliant, I'm always a little suspect, because I feel like we're HIPAA aligned. That is a huge piece of legislation, and it's very difficult to come into full compliance with that. What the government's really looking for is our due diligence. And so that's the first part of that. The second part of that, the question is, you need to know if an entity like, you know, Zoom or Teams or any of the other groups that are out there that have platforms have any kind of HIPAA compliance claim. So that's your first starting point, right? And there are some of the platforms that are saying, hey, listen, we are not HIPAA compliant, and what they're basically saying is that we don't offer any encryption for these communications from end to end, and we're not, even if we're storing these conversations, we don't have a way to protect those to make sure that they don't get out into the wrong hands. And so that's the first thing. What is their claim? And you have to look at the encryption piece. So if they claim they're HIPAA compliant, how are they protecting the conversation? Is the conversation protected end to end? Are they storing those conversations? Are they recording and storing those conversations anywhere? And if so, where? Will they enter into a business associate agreement? Because if they're not going to enter into a business associate agreement, kind of makes it a moot point. They are your business associate if they access, store, create, maintain PHI for you, so protected health information. So whether you actually enter into a business associate agreement with somebody or not, if they are acting in the role of a business associate, they are your business associate. And so though the Jay Severino, Director Severino, made the statement about relaxing the rules around telehealth, what they were very clear to say was that there's still the due diligence piece has to be there. You can't use Facebook Live. You can't use a platform that flat out says, look, we're not compliant. You should be looking, doing the due diligence. What are all the platforms that are available to you? How can I best offer this service to our clients? And then the other piece of it is that you can have a technology that offers security, that offers the so-called compliance part of it, but you also have the people aspect. And so you have to think about where I may have a tool that offers the right security. Now I'm letting people use that tool, and that's where compliance and conforming to the rules usually falls away. So where am I sitting at when I'm doing that telehealth conversation? What is visible in the background? Who can be heard in the background? So do I have a white wall behind me? They can't see my computer screen. I'm doing this on a computer or a tablet that is separate from my EHR to ensure that there's no accidental sharing of my screen, sharing of any PHI that might be around. And so you have to first consider the platform, whether these people are going to enter into or willing to enter into a business associate agreement with you. What are their claims for encryption? Are they storing the conversations or not? And those platforms will tell you if they are or not. And then consider the people aspect of it as well. How do we, once we get the platform in place, how do we make sure that we minimize risk of some kind of incident or breach?
And just to piggyback on that, Angela, I think the people piece is really important, especially right now, because we're sending so many people home to telework. And a lot of times people want to leverage telemedicine so that they can go home. And again, when you're outside of your practice environment or your office environment, that capability for a breach is much more significant. And so, making sure, do you want to allow people even to do telehealth at home? Or do they need to still come into the office and be in a room that's specifically set up to manage those telehealth visits and things like that? So that's an important component, because as our workforce is changing and how we work is changing as a result of COVID-19, it also introduces that environmental risk a lot more, I think.
So the piece that you just talked about, Tommie, brings us back to an important aspect of the HIPAA rules that many entities have ignored for a very long time, and that's contingency planning, right? So if we are not set up for telework or telehealth, and now we're thrust into this environment where there is no option for that, this is something we should have had a plan for. So, and this is a learning curve for everybody, I think for compliance folks, HR folks, and for medical and dental practices alike. But this is a part of contingency planning. If we are in this extended period where we have to offer telehealth from home, first of all, what are the insurance rules that surround that? Because insurance does play into that, where the provider is specifically located when they provide the service. And then what equipment are they using? So I would not want my employees to use their home computer to provide telehealth services. It should be a device that is owned by the practice, that is supported by the practice's IT, so that we can make sure that it's patched and we've got the right antivirus and firewalls in place, all the security is there, and that if it is lost or stolen, then that our IT group can brick that device. And then, again, to that point of where in the home am I going to provide this service, right? So do you have an office? Do you have a space where you can provide it that provides privacy for the patient on the other end? And then at the end of the day, when you're done, how do you secure any paperwork, and how do you secure that device? And even though it's your home and your family, they are still not part of the workforce, part of the covered entity. And I think that's the hard part for us sometimes is, it's my kid or my husband or my wife, and I trust them. But the rules are still there, and we still have to make sure that we're protecting that information the same as we would in the practice itself. I would never allow my husband or my wife or my child to come in and go through medical records or look at my computer at the workplace. And so I can't do that at home either.
Yeah. That makes sense. We just had a question to pivot real quick. I want to make sure that we get to this. Lisa had the question, can an employer require employees to take their temperature when they arrive at work in the morning during this pandemic?
I'll answer that from an HR perspective. Absolutely. I think if you, one of the things that you have to make sure that you're doing as an employer is creating a work environment that's safe for your employees. And so in times like this, I think doing your screening procedures, and quite honestly, you should be screening anybody who comes into your practice or your office, right? So it's not just your employees, but your patients too. And so I've actually worked with a client, they've implemented screening guidelines. So it's not just temperature checks, but it's also asking, if they've traveled to any of the areas of concern as listed under the CDC guidelines, whether or not they've had a fever within the last, several days, whether or not they've had a cough, shortness of breath, so there's on the CDC guide, on the CDC website, there are certain questions that can be asked. And if anybody wants a copy of that, I can send that out and we can share a sample template on that.
There's also a template, Tommie, too, that if you're doing telehealth, that before you even see the patient, you can have a screening form that they have to fill out before the doctor will do it. Because if, for instance, you have coronavirus, maybe telehealth they have to determine what's the best avenue to take if, for instance, you may have that. So there's actually a screening tool you can use for your telehealth too.
Great.
That's good.
I would also say that if you have somebody who's your screener, make sure that they have a mask and gloves if they're taking the temperature. And if you can, try to get an infrared temperature gauge. If you don't have that, forehead, but make sure that they're getting wipes down in between each of the screens as well. So, again, practice good PPE and distancing practice.
Yeah, behind the toilet paper shortage, there is a shortage of thermometers as well. I had several clients that were actually, when this first began, checking temperatures on all patients that came in, recording them. And it was more from a risk management perspective. Simply to show that, hey, we are doing this, and when they were in the practice, they had a normal temperature, so that if anything happened, they would have that documentation later on. But I don't know how easy it is at this point to get your hands on a thermometer if you didn't already have them in practice.
Yeah, and I would say, and Tiffany would probably agree with this, from a communication standpoint, if you're doing this screening before your patients come in, your employees, communicating it that it's not arbitrary, that's not, if it's some sort of
signage
procedure in place, a sign, so that it's not just a person coming in and being like, you're targeting me because I coughed, it's allergies. Because as Tiffany alluded to, it is allergy season and there are people may get defensive, but that way they know this is the procedure across the board, could sort of prevent some problems that may arise.
So if you go back to the screening thing, I think this kind of lines up with the question that Amber just popped up on the screen. There's a couple of things that we should be doing about screening patients before they come into our practices. And one of those is that we probably need to go back to, or we should go back to, the traditional method of confirming visits, which is a phone call. Today we use text messaging quite a bit to confirm visits with our patients. So that doesn't give us the opportunity to speak with them and say, hey, have you had a fever in the last 2 weeks? Do you think you've been exposed to somebody who has COVID? Have you had any respiratory symptoms? So that's one of the first things that we should be considering in our screening process. The other thing that we're seeing is that medical practices are setting up tables outside of the practice, and they are screening patients before they come in. I totally understand, because I deal with allergies myself, right? But I totally understand from that employee's perspective who is sitting outside with that person who's coughing or sneezing. How do I know that this is COVID-19, the flu, an average cold, or it's allergies, or some combination thereof? So having stopping the patients outside so we can determine which way we're going to funnel them. And then from that perspective, having patients wait in their cars, your car becomes your waiting area. And this is well or sick, right? It doesn't matter at this point in time. And this is really something that I've always emphasized to clients, that cold and flu season, we need to be more vigilant, right? And coronavirus has just brought that to the forefront. And so during, I think, any cold and flu season, during this time, if you need to see your patients, if they need to be seen in your practice, have somebody check them in before they even enter the practice, and have them wait in the car, and we can either come knock on the window and say, your turn, or we can call them, because most everybody's going to have cell phones today, so we can call them and then escort them directly to the exam room that they're going to be treated in, and escort them back out again. Unless you're like one of the testing sites, I would venture to say that a lot of our practices have really slowed down and can afford that time to escort patients back and forth, instead of just letting them walk throughout the practice and not knowing what they're touching, what they're coming into contact with, because that's what it comes down to, right? I would hope that everybody has the same hygiene practices that I do, but we know that that's not reality, right? And so when you're on that train, or on that bus, or on that plane with the person who's coughing, even though logically I know holding my breath does nothing for me, I still do that, right?
I do in the grocery store. I'm like,
yeah. So I mean, even though logically
like
I know that holding my breath does
graveyard.
nothing for me, I still want to do that. So how can we minimize this kind of thing happening? And that's by making sure that we don't gather people together in the waiting areas. One other thing that I think we're going to have to reevaluate in the healthcare and in the dental setting is who is in our practice. So I will tell you, and I think anybody that's on this call, except for maybe Lisa, just because of what they do, the research piece, it used, 25 years ago, when a patient came into your practice, the patient came into your practice, and maybe a caregiver if it was required. But now what we're seeing is the patient comes in, and all of their children, and the children they're babysitting, and their brother and their cousin and their nephew and the neighbor next door who thinks that they might want to work in healthcare. And so now we have all of these people who are sitting in our waiting areas who are those potential reservoirs, right? So if they're sick, they're sitting in this area, they're sitting in this room with all of these people, and we're crowding more and more people. The other thing that we're seeing is not just our waiting rooms, but now they want to go into our exam rooms and our operatories. And I would say that most especially during cold and flu season, and most especially in dental practices, we should not be allowing anybody other than the patient into that operatory. Our spray and spatter zone in a dental office is 3 to 6 feet. Some 700 different microorganisms make themselves at home in your mouth. And then we spray, and I'm sorry, Elizabeth, and then we spatter,
I know this stuff,
right?
but still.
So that is sprayed and spattered into the environment. Between patients, we disinfect what we call clinical contact surfaces. So these are surfaces that we expect to come into contact with or that we know have been contaminated. A surface that we do not disinfect between patients as a general rule, unless there was some kind of a spill, is the floor. So who wants their children crawling around on a floor in a medical or a dental practice? Who wants to sit on the floor in a medical or a dental practice? Because what this means now is this is why the don't touch your face thing is so important. It's all of these surfaces that we come into contact with. It's not that there's just inherently some way that my hand magically has COVID-19 or influenza or anything else. It's that we tend to touch so many surfaces, and then we don't realize how many times throughout a day we touch our face and our hair, and we adjust our clothing, play with our ears, right? We have no idea how many times we do that. People with allergies, how often are you scratching your nose or rubbing your nose? And so those are things that we really need to start reevaluating.
Yeah, agreed. I think it's going to become our new normal, seeing some of these changes in our operational practices to mitigate risk. Absolutely.
I'm looking through my different questions. We covered a lot of questions that were already included, so I'm trying to skip them. Like, no, she already talked about that. She talked about that. One question that is kind of,
did you see the one in the chat? There's one that came up.
Yes, that was the one I did. It was the can I require?
Oh, no, there's two more that came up.
Oh, they did?
Yeah, I just wanted to make sure, since we're coming to the top of the hour, that we get them.
Yeah. Okay. Let me.
Curbside visits.
So with curbside visits, right now that's kind of the drive-by. There's no guidance that is out there on this, unfortunately, and that's because we've never been in this position, in this environment before. Is there any rule against it? No. What is our mandate is to provide privacy. And so what I have said to my clients who are providing the curbside or the drive-through services, medical offices, that to try to set it up in such a way that you can afford or provide as much privacy to the patient as you possibly can. One of my clients in the here in Virginia was doing the drive-bys, and they had the curbside visits, and they had done a really good job. They were bringing the patients around the back side of the building. They had set up tables. They had done all the things they needed to do. And some random person roams in and starts filming what they're doing. And part of that is just our lack of consideration in this society. We think we have a right to film everything that's happening everywhere. And so the question was, what can we do about that? If there's a way to extend a barrier to which people can't come past, that would be a great way, making sure that you are directing traffic. And when you see people that are not patients, asking them to step out of that area so that you can offer that privacy to the patients. But also don't engage and try to beat anybody up and take their phones and their cameras from them, because I don't want to read about my clients in the newspaper or see you on the news for assaulting videographers. So
one thing I would also add to that is that also make sure that the environment where you set this up, if you do the curbside visits, is safe for your employees. I think that, again, is your workplace is now extending into a parking lot area or a back entrance area. And so making sure that you're mindful that you have appropriate safety measures in place for your employees, and what hours are you doing this, and different things like that. So,
and communicate.
And if I can pick back up on just one more HIPAA aspect of that. If you have to have paper outside, make sure you have a way to contain it and control it. Unfortunately, I've had a client who was doing the curbside. They did not control the paperwork very well. The papers went flying, the wind picked them up, and they recovered all but one piece. And so the unfortunate thing is what was on that paperwork, it's now a reportable breach, right? Because they couldn't get that paper back. So, and when they called me and talked to me about it, I said, I think I would send my employees on a scavenger hunt right now. And the unfortunate thing was that they'd been on one and they still could not find that one piece of document. So think about all the things that you have to control. Make sure that your computers, if you've got laptops and tablets outside, make sure that they are not positioned in such a way that if somebody does walk up filming, that they can film your computers, that they can see paperwork, and make sure you can control that paperwork.
Make sure you communicate with your patients what to expect with curbside service, so to speak. Definitely on your website, social media, so they feel comfortable with it. If you lay out what that's going to look like, how it's going to be controlled and everything, they're more apt to take advantage of that. So communication.
Yep. And we have that. I'm going to get that other question that came up on the chat. Let me toggle back to that. I know the answer to this question, I feel. Can practices arrange a time with Angela to evaluate the protocol and practices we have in place for seeing patients right now?
I'll let you answer that, Elizabeth.
Yes. Yes, you can.
Absolutely. So that's what I'm here for, right? And during this time, my whole thought process is around how can I help my clients best? Because this is, we're in uncharted territory, right? And I've talked to several clients, and my comment to them always is that we need to weather this storm together. So anything that I can do to help my clients during this time frame, I'm going to absolutely do that. I'm going to answer questions. I'm going to provide help or documentation, whatever we need to do during this time frame to make sure that we all get through it.
And we have now reached the top of the hour, but I wanted to say this. I am Elizabeth Johnson Phillips. If you have more questions, my job is content developer. So my job is actually to hear your questions and then make content for you that answers that questions, either by putting it on Angela's website or the MPWRSource website, the Proactive website, whether it's CentraVance, to hear your questions and give you information that helps you do your job better. So if you have further questions, you can direct them to me and I can field them to the correct person, and we can make sure that you have those questions answered to sort of bridge the gap after this panel is over. I am going to, if I can figure out how to do it, let's be clear on that, share with you, if you go to the MPWRSource website at the top, I'm going to try to share my screen. There is right here. You'll be able to see right here. There is, we have COVID-19 resources on our website, and it should be going to there. I love the fact that you can see I have Nestle Toll House cooking recipe right there. We have an entire website that has everything from how to apply OSHA guidelines, things about telemedicine that can apply here. And this gets updated a lot. I'm not going to say daily, but I'm going to say most of the time, at least once a day. It gets more things. We also have links on here. But that way you can get in touch with me or get in touch with Angela at CentraVance. Or any of us here want to be able to meet your needs and answer your questions as they come. If there's any more questions that you have, shoot them to me and I'll be happy to answer them. But I think that that's all we have this morning. Thank you very much, everyone, for coming. I've really enjoyed it. My kids were confused that I actually got dressed today in real clothes. So it's been a nice change of pace for me. So thank you so much.
Thank you.
Thank you.